The IGNYTE study is a global phase 1, phase 2 study looking at multiple tumor types and investigating the novel oncolytic virus RP1 combined with PD1 therapy. In this study, the PD1 inhibitor used was Nivolumab. The IGNYTE study included a registrational cohort of patients with melanoma who had failed prior anti-PD1 therapy. The total number of patients was 140 in this cohort. And the criteria were pretty strict, but these patients were required to have failed at least 8 weeks of prior PD1 therapy immediately prior to being treated with RP1. The patients first received a single dose of RP1 and then a combination of RP1 with Nivolumab for up to 8 doses. And then if patients were benefiting, they continued on monotherapy Nivolumab for up to 2 years. And if clinically indicated, the patients could be resumed on RP1 as well. The primary endpoint was looking at efficacy using modified RECIST, and secondary endpoints looked at objective response rates, duration of response, disease control benefit, and progression-free survival and overall survival. And so this was considered to be a very real-world cohort in the sense that there were patients with not only stage 3, but also stage 4 disease, including M1B to M1D. Nearly half the patients had received prior PD1 and CTLA-4 combination therapy, and 2/3 of patients had primary resistant disease. So these were really considered to be difficult to treat melanoma patients that had otherwise failed standard therapies. And so the primary endpoint, looking at objective response rate across all cohorts and for the entire cohort, was roughly about 33%. And this was regardless of whether you had received both PD1 and CTLA-4 or monotherapy, whether you'd received therapy in the adjuvant setting versus the metastatic setting, whether you had primary or acquired resistance, irrespective of BRAF. Basically, all sub-analyses showed this to be a fairly consistent response rate of about 1 in 3 patients. Responses were durable. The median duration response was about 22 months. And at this point in time, the median duration of follow-up has been about 1 year, actually 15 months. And 1 year overall survival rates were estimated at about 75%. And 2 years at 63%. So we think this is quite good efficacy. And importantly, RP1 appears to be quite safe. I think similarly to TVEC, it's an extremely tolerable therapy. Grade 3 and higher toxicity rates are 10 to 12%. And mostly patients have low-grade flu-like symptoms for 1 to 2 days after each injection. These are easily managed with Tylenol and other over-the-counter therapies, but really no major toxicities, certainly no grade 5 events. So I think considering the risk-benefit ratio, this is a promising new approach.